Welcome back to the Weekend Report. I'm Masachaba Mphoswa. Over the past few days, parts of South Africa have experienced heightened temperatures classified as heat waves. The extremely hot conditions are expected to persist over several more days. There are health hazards that come with extremely hot temperatures like heat exhaustion and heat stroke. Let's discuss further now with emergency medicine specialist consultant at Steve Biko Academic Hospital, Dr. Maxine Milton, who joins us now. Good morning, doctor. Thank you so much for your time.
Good morning, Mr. Trevor. Thank you so much for having me. It's an honor and a privilege. Thank you.
First of all, what are some of the health hazards from these incumbent heat waves that we've been experiencing besides the usual heat strokes and heat exhaustion?
Yes, so as you know, like you said, health-related illnesses is quite a wide variety of illnesses that's covered by this term. It exists on a continuum. So essentially, we can have very mild symptoms like your heat edema, your heat syncope, heat cramps, but it can also progress to more severe illnesses like heat exhaustion and life-threatening heat stroke, as you mentioned. And that's why it's quite important to recognize early on when the symptoms actually start implementing itself, so that you can seek appropriate medical attention or, just do the normal cooling methods and so on. Other things that we often see in the emergency department is people presenting with electrolyte imbalances because of the excessive sweating. This can lead to a lot of electrolyte losses, like your sodium, your potassium, and other electrolytes. And so we need to replace this in the emergency department. Of course, we can also have a condition called rhabdomyolysis. This is muscle destruction that can take place because of excessive heat. It's often seen in athletes, and because of the overexertion and the hot temperatures, and this actually predisposes people to acute kidney injury, which is also something that we can quite often see, not only because of the dehydration, but because of rhabdomyolysis as well. So kidney injuries, quite often we see skin injuries, we see in patients presenting. So it can even affect people's mental health. So people with pre-existing mental conditions often become quite anxious and depressed during these episodes. So it's quite a wide spectrum of illnesses that we can account in the emergency department, and that one should be cognizant of.
How often do you see patients coming into hospital who present these symptoms, and what are these symptoms?
So we do see people coming into the emergency department quite often because the warnings are sent out, but we don't always heed the warnings, or we don't always hear the warnings that's sent out. So symptoms would, of course, start with feeling thirsty, excessive sweating, but it can progress to getting palpitations or your heart beating faster. You can become dizzy, you can faint, which is your heat syncope. They can have muscle cramps because of the potassium electrolyte depletion in the body. So we do see it quite often. In terms of your heat stroke, that's, of course, the more severe presentation that comes to the emergency department. And this is the characteristic feature is that there is an implication to the mental status of the patient. So the patients could present with loss of consciousness, they can present with seizures, or things like that. And that's something that we need to be quite active in management, because that's actually a life-threatening condition that presents. So the earlier symptoms, those are the ones that we should try and treat. In fact, we should actually try and prevent prior to it becoming a problem. So in these extreme conditions, you should ideally be preventing rather than waiting for it to progress to an illness.
And let's talk about the prevention measures that people should be taking.
Yeah, sure. So we should be quite proactive, especially if a warning has been given through to us. So in terms of your staying cool, you want to try and stay in air-conditioned spaces. I know for a lot of South Africans, that's not always possible. But of course, you can then go to a building that's air-conditioned, like go to a mall, any excuse to shopping for us as ladies, But you can also then make use of your cooling fans. You should have well-ventilated areas. And then the type of clothing that you wear is quite important as well. As you can see, I'm wearing my light-colored scrubs today for this interview, just to reiterate that fact, because your lighter-colored clothes is better, your loose-fitting clothes is better. And then you should stay hydrated. You should make sure that you preempt and stay hydrated. Have a lot of fluids. If you are doing strenuous activity, then of course your electrolyte containing fluids is quite important. And then by fluids, we don't mean alcohol and caffeine and such, because that actually causes dehydration. So you want to avoid those. And then, of course, you should limit your outdoor exposure. I know it's not always possible because a lot of us have activities that you have to do outside. But in terms of that, if you can then take frequent breaks and go into a shaded area, apply sunscreen, that's quite important. In terms of your vulnerable population, you need to check on them. You've got your elderly, they won't always, hear that there was actually a warning issued. So you should check on people that's not able to move themselves to a cooler place. Of course, your pets and your homes, there's a lot of things that you can do at home, like close your curtains, close your blinds, make sure that the pets are well taken care of, well hydrated, they've got a shady place where they can go to. So there's quite a bit of things that you can actually do yourself to just try and prevent.
All right.
And of course, you need to recognize the symptoms early, like we said, because if they do occur, you need to seek help early, because we don't want it to progress to the other extreme.